Thank you, everyone, for joining us today as OKSA connects with Terri White, the Chief Executive Officer of Mental Health Association Oklahoma. May is National Mental Health Awareness Month. So to honor this month, we are very grateful that Terri could join us. And before we get into our interview and questions and discussions with Terri, I'd like to give some background on mental health, especially for young people. Depression, anxiety, and other mental health issues affect people of all ages and backgrounds. However, teenagers are an especially vulnerable population with multiple physical and emotional changes, possibly worsening pre-existing mental health issues. The research shows that the rate of serious mental health was high for 18 to 25-year-olds by 7.4% than any other age group. And in addition, the onset of 50% of adult mental health disorders occurs by age 14 and for 75% of adults by age 24. So you can see that the up until age 24, 25, it's a very important age range that mental health needs to be taken care of. We're very grateful that Terri is here with us to discuss these things and discuss services that are available for young people. I would like to have a brief introduction for Terri. Terri White is the Executive Chief Officer of Mental Health Association of Oklahoma. Under her direction, the association continues to expand the reach of its innovative programs and services designed to serve Oklahomans and their loved ones affected by mental illness, homelessness, substance abuse, and justice involvement. White is the former commissioner for the Oklahoma Department of Mental Health and Substance Abuse Services. Because of her leadership, Oklahoma Department of Mental Health and Substance Abuse Services became nationally known for children's behavioral health services, community-based treatment programs for adults, technology innovations such as telepsychiatry, and the integration of behavioral health care into primary healthcare setting, which, as we all know, with current telehealth situation is very, very valuable. So welcome, Terri, to coming to OKSA Connects. And if there's anything I've missed in the introduction, please feel free to mention those.
I think you covered everything. That was very kind. And I first want to thank you for having me. I'm excited to have this discussion today. Brain health and mental health is such an important topic that I'm just thrilled to be here and to be talking about it and hopefully reach an audience that needs to hear the message.
Thank you. Just for our audience watching from Facebook Live or Zoom, you can send questions in the chat or the comment section of Facebook if you have any questions for Terri. Terri, as we said, May is National Mental Health Awareness Month. Why do you think Mental Health Awareness Month is important? What purpose does it serve?
I think it's incredibly important that May is Mental Health Awareness Month because it gives us an opportunity and really the perfect time to talk openly about brain health. It's often a topic that isn't discussed. If you think back to how folks might have used to talk, and I use this example, my grandmother used to whisper about someone having cancer, and she would whisper the word cancer. And today, if I was wearing a pink ribbon, for example, you might be thinking I was supporting breast cancer awareness or the fight against breast cancer. We talk about it very openly, but there's a time we didn't. And unfortunately, when it comes to mental health issues, we're still back at that time where people maybe don't feel comfortable talking about it. But having candid discussions about mental health and addiction is one of the best ways that we can destigmatize these diseases so people aren't afraid to talk about them or don't know how to reach out for help, maybe when they need it most.
Yeah.
So as we look at these things, I think It's important for people to understand mental illness is a disease just like any other disease. So the way I equate it is diabetes is a disease where your pancreas isn't secreting the right amount of insulin. The chemicals aren't working correctly. Mental illness and addiction are actually very similar diseases. It's just instead of the pancreas, it's the brain. It's where the chemicals in the brain either aren't being secreted correctly or aren't able to be taken up and used correctly. But the thing about mental illness, just like the thing about diabetes, is people can and do recover. They can lead full and productive lives. It is absolutely a treatable disease. And I think people need to know that. Often people think that it's hard, or it's maybe even more hard to treat than other diseases, but the research and the data show over and over that's actually not true.
Yeah, that's a very good point that you mentioned, that both mental illness and also addictions are real medical conditions, just like diabetes, cardiovascular disease, and heart disease. They're real things. Research shows that in Oklahoma, mental health disorders are the third leading cause of chronic disease, like it has physical symptoms. So it's very important, just like any other issues we would have physically.
Absolutely.
So as we know, mental illness, substance abuse, and increased suicide rates are big issues nationally, but especially prominent in our state, Oklahoma. What do you think is contributing to this challenge, and what are some solutions?
I think that's a great question. First, just so people kind of have a context, 1 out of every 4 Oklahomans struggles with mental illness or addiction each year. So it's 1 out of every 4 of us. It looks like you, it looks like me, it's our friends, it's our family, it's members of our community of faith, it's members of our university, it's people who are leading companies, it's individuals who are serving our country, and it's also people who, because they haven't had access to treatment, have lost everything. So it's 1 out of every 4 of us. And while it's 1 out of every 4 of us, when you look at that 25% of the population that's struggling, only 1/3 of them are able to access treatment. And when you can't get access to treatment, it's really hard to recover. So when we think about it being Mental Health Awareness Month, it is a really important time for us to talk about the need to increase access to treatment. Mental illness and brain health are a continuum, and this disease is like any other disease. If you have a disease and you're not able to get treatment, the disease progresses, the disease gets worse, and people get sicker. But as I mentioned earlier, the good news is that this is a disease like any other disease. And with access to evidence-based care and treatment, it's absolutely treatable. And every Oklahoman deserves that opportunity. Some people still hold the belief that there's maybe 2 kinds of mental health and addiction, that sometimes they think those that are affected that they know in their families, or those who might have a mild case, the people we know and love, that's a mild mental health issue, and that's somehow different than other folks. And those other people who are really struggling and we see end up in the back of a police car, or we see ending up homeless and those things, as if they're 2 different diseases. They're not. The difference is whether people have access to treatment. And so when we think about these issues and people who might end up homeless or who've ended up in the criminal justice system, there's not a bright line demarcation. It's really about whether or not people have access to treatment and supports.
Yeah, the access to treatment and support is a big one here. What about trauma-informed care infrastructure? What does it, first of all, what does it mean, trauma-informed care infrastructure? And how can organizations and care providers incorporate it in their day-to-day caregiving duties?
I think the first thing to talk about is, I think it's a great question, and why are we talking about trauma-informed care? And so I think it's important for people who are watching or listening to know that trauma, whether it's childhood trauma or a trauma that might occur in your adult life, could be the trauma that you might experience while being deployed while serving our country, could be the loss of a loved one, could be any form of trauma, actually changes the brain. And when people experience trauma, sometimes their brain changes in a way that it will actually cause the onset of mental illness and addiction. There's a really strong link between trauma and mental illness and addiction. And so that's why it's important that if we're going to treat these issues, that we have trauma-informed care and know people who know how to actually address and treat trauma so that the root cause or one of the connections to mental illness and addiction is actually treated and addressed. So I read a piece from the National Council for Behavioral Health on how trauma-informed and resilience-oriented care is actually part of your culture if you're a provider and you're doing it well. It's part of your structure and your treatment framework that's built on understanding, recognizing, and responding to all kinds of trauma. That same piece made a tremendous point when it explained that trauma-informed and resilience-oriented care asks not what's wrong with you, but what happened to you? What have been your experiences? And what's strong with you so that we can build on that for people to get well. Going forward, I think implementing a trauma-informed, resilient-oriented approach really marks a fundamental shift in care delivery. The bottom line is we can catch health issues upstream, reduce dependence on emergency departments, decrease missed appointments. The outcome is reduced costs, a healthier population, enhanced healthcare, and most importantly, people living a life in recovery.
Yeah. I think that's a very good point where childhood trauma can have a profound impact on child's development, behavior, ability to cope with normal stress, and future mental and physical health. While they say that childhood trauma or trauma in general can change your brain, but therapy and as you said, those culture of care can actually rewire your brain so you're suited for a healthier life.
Yeah, a lot of times people don't understand what is it that happens if this is something that's happening in your brain or a chemical issue in your brain or and when we say trauma changes the brain, what it does is it changes the way the chemicals are working in your brain. And so people wonder, well, then how do you get better? And I think what the point you just made is really important for people to understand, which is with treatment, for some people it's medication, for some people it's therapy, for some people it's both or other forms of support, that does actually change the brain back, if you will. And that's how people recover. It's amazing because people a lot of times misunderstand the brain. And there's this mythology that your brain, while it's certainly it grows fastest during adolescence and childhood, which is why childhood trauma is such an important discussion about brain health and brain development and the development of mental illness and addiction, your brain does change your whole life. And that is how treatment works. So I actually think that's an excellent point you made.
Yeah, thank you. So how can we help our youth enhance their emotional and physiological, psychological health so that they're healthier mental health wise? How can we enhance that for our young people? As we discussed, it's a very important aspect of their growth and development.
Well, first, youth need to feel comfortable and encouraged to express themselves in positive ways. One thing they can do is if they're struggling is talk to a trusted adult, and they need to know that that adult is open and willing to have the conversation by that adult having already talked about mental health, just like we might talk about asthma or diabetes or whatever we might talk about as a child or a youth is growing. They also need to have positive coping behaviors when they're struggling, such as can be things like going for a walk. And this is in the early stages of dealing with stress or anxiety, going for a walk, listening to music, a creative outlet, like maybe painting, something that allows them to express themselves in a positive way, as opposed to those feelings and emotions coming out in a negative way. But the most critical aspect is being able to talk to a trusted adult about how they're really feeling and surrounding themselves with positive people, engaging in positive behaviors and positive activities. Whether we're a youth or an adult, we think it's incredibly important that we understand that our brain health is just like our physical health. We need good sleep, healthy nutrition, and exercise. All of those things that help us as we think about our physical health, if you will, physically are good for our brain as well and can actually help protect and be a protective factor against developing mental health and addiction or helping someone to cope with stress or trauma or any of the things that they might be dealing with. And not all children and parents respond to stress or adversity in the same way. And parents, one of the things I often get asked is, what do I need to be looking for in my child? If I'm wondering, and it's looking for serious changes in how their child learns, copes, behaves, or handles stress or self-control. And it can be things like, in younger children, excessive crying or annoying behavior. For all kids, it can look like increased sadness, depression, anxiety, nightmares, inability to sleep, explosive temper or out of control behaviors, difficulty concentrating or focusing attention, changes or avoiding activities that they've enjoyed in the past and withdrawing. Even unexpected headaches and pain throughout the body can look more like a physical health issue, but can actually be tied to mental health. And if a parent sees a significant decrease in positive behaviors or a significant increase in negative behaviors or a child's ability to function, that may be a time to seek help. And one of the things we want people to know is it's okay to ask for help, particularly if we think about this pandemic over the last year, as parents have been maybe working at home and schooling at home and dealing with just a whole different level of increase of stress. It's okay to feel overwhelmed or not be certain or need help. And we need people to feel comfortable reaching out for help. So if you're concerned about your adolescent's mental health or your child's or your young adults, Mental Health Association Oklahoma actually offers a free student mental health screening. It's part of our youth wellness program. It's available for 6th through 12th graders in both Tulsa and Oklahoma City, but in some areas outside of Tulsa and Oklahoma City as well. And in that specific assessment, the child can complete a computer-based survey of mental health concerns. And we actually have screeners. And if the screener identifies mental health concerns, which includes suicidal thoughts or behavior, the parent and the screener will work together to create a plan to connect that young adult or that teenager with the necessary supports and treatments that they need. And our screeners will actually continue to provide support to that family until that child or that teenager actually engages with services. So if anyone who's listening needs more information about that, please feel free to visit our website, which is mhaok.org for more information, or you're welcome to call our Mental Health Assistance Center in Tulsa. That number is 918-585-1213. In Oklahoma City, that number is 405-943-3700.
And we will also add this information in the comments section. If someone missed it, they can just see the website and the phone number there. And you might have already answered this question, but what would you say to someone who feels they have an issue they need to address, but they do not know where to start?
Yeah, a lot of times, if you think about other diseases, we know to go to our pediatrician, for example, or our family medicine doctor. Certainly those are places to start if you don't know where else to start, because our pediatricians and our family physicians should be trained and comfortable in at least making connections to these issues. But in case that your personal physician is not, or in case for whatever reason you don't feel comfortable or don't have a relationship with a physician, one of the things that's available at our website, as we talked about, is if you visit our website, we have free and confidential mental health screenings available for adults as well. Mental Health America is the creator of the screening. It's an evidence-based, valid, and reliable screening. And it's one of the quickest and easiest ways to determine whether or not you're experiencing symptoms that might be a mental health condition, because sometimes people just don't know if that's what's going on. The mental health conditions such as depression and anxiety are real, they're common, and they're treatable, and recovery is possible. So again, if you want to reach out to us either through our website or our mental health assistance phone numbers, we are here and we can help make those connections. The other number that's important for people to know is 211. 211 has two options. 211 is the statewide hotline for suicide information, prevention, and emergency intervention. So the suicide hotline is 211. But even much more broadly than that, 211 is there as a resource center to connect people with any resources or social services they might need. So not only are they there if someone is experiencing food insecurity and needs food or assistance with a heating or cooling bill, they're also there to connect people to mental health resources. So if someone is struggling and the only thing they might remember from today's call, just remember, or this discussion today, just remember 211. And that's a number where they can connect you to resources anywhere in the state.
Thank you for sharing that. And what tips do you have for caregivers who have crucial conversations with their teens about mental health and the importance of it?
Sometimes there's a strong stigma when it comes to talking about mental health, as we talked about earlier. Sometimes people don't feel comfortable. Some parents may think it's their fault that their child may be experiencing mental health issues or even a mental health crisis. And one of the things we want parents to know is that's not the case. Kids experience healthcare issues, whether it's asthma, diabetes, or mental health. And there are many mitigating factors why anyone, whether it's a child, a teen, or an adult, may be experiencing mental health issues or a crisis. It's not anybody's fault. If our coping skills are maxed out, then we struggle to figure out how to continue to cope, especially our kids. So trying to make talking about mental health issues normal, that it be a regular conversation you'd have at the dinner table, riding in the car with your kiddo or with your teenager is also a great time to have conversations.
You're
can often have more
together, you're stuck.
Yes, exactly. And you can have more in-depth conversations as well. I have an 11-year-old little boy, and some of our best conversations have taken place either when we've been doing a walk or when we've been in the car together. And it's not how long you spend with someone, it's what you talk about when you're with them. If they're telling you that they're hurting, don't take it personally. Just remember to take yourself out of that scenario, and you can talk about things like, let's talk about what might help you. Let's talk about finding someone who can help us with this and help us with this as a family, so they feel comfortable and included that this is something that the whole family is going to help them address. Mental Health Association Oklahoma offers, as I mentioned, a free youth mental health screening that links families to referral and help that can help them also navigate a complex mental health system. And when they access services through us, through that screening, and then we connect them with services, we also continue to check on them to make sure that they're getting the help they need. But again, just like any issue, one of the things I tell parents is it's important that you feel comfortable talking about it. Because if you're uncomfortable, your child's going to feel uncomfortable. And if parents need resources on how to have those conversations, we're happy to provide those too.
Mm-hmm. I think that's a really good point. If caregivers need resources on how to have those conversations, because one big aspect of it is like validating their feelings, like not making it seem small. It may be a big problem for them, big issue for them. So I think it's a good point that they can reach out to Mental Health Association Oklahoma if they need like a script or how to talk to them, how to validate feelings.
I think that's a great point, because I think sometimes parents also, just like all of us, when it comes to stigma around mental health, there's kind of a mythology. For example, particularly when it comes to suicide. Some people believe that if you talk about suicide, you're more likely to actually cause it to happen. And that's absolutely false. Mm-hmm. The data shows over and over that if someone is contemplating suicide and you talk to them about it, it decreases the chances that they're going to die by suicide. It doesn't increase them. And so feeling comfortable talking about this becomes really, really important.
Yeah. So as we all know that we have been in COVID-19 pandemic for over a year now, what would you say are the short-term and long-term impacts of COVID on young adults and caregivers?
Children are particularly vulnerable to mental health effects from the pandemic, resulting from school closures, an interruption of their social connections, isolation, loneliness, the strain on their families. They may have had a prolonged state of physical isolation from their friends and their peers, which is really important for children and teenagers. They may not be seeing their teachers, who might have been really safe people in their lives that they're no longer have contact with. They may not be able to see their extended family. And along the lines of loss of school-based social support, they may have lost their activities, their routines, the rituals, the things we all know that kids thrive actually with structure. And that structure for many people has been upended. It certainly was for a good portion of time, even, and for some people that's still continuing. And that impact of the lockdown is going to vary between children. Some will bounce right back and others will struggle. And there's a growing concern that the prolonged state of disruption in children's lives is actually going to create a tsunami of mental health effects for those children. Research shows prolonged loneliness can be devastating to the mental health of children and teens, giving rise to depression, anxiety, distraction, and irritability. Younger children may be a peer to managing stress and anxiety, but that's often because they don't know how to express those feelings. They rely heavily on adults around them for support, which means if the family's stressed, and we know that one of the things that occurred during the pandemic is lots of people lost jobs, which is obviously a huge stress on a family. And so if the family is stressed, and many are right now, that child will feel that stress and carry that stress. It comes out in all kinds of ways. If children don't have the ability to express it, it can look like temper tantrums, changes in eating and sleeping habits, aggression, bedwetting for younger and even some teens. Children with pre-existing mental health challenges, kids who were struggling maybe or had mental health issues, even if they were doing well before the pandemic, COVID could have exacerbated that for those children. So it's actually estimated that between 30 and 50% of children who received 30 to 50% of children received mental health care in schools prior to schools shutting down last March. And with school closings, many of these children lost their access to the mental health services they counted on. Children who may be experiencing adverse childhood experiences, ACEs, for those of you that may not know, ACEs are adverse childhood experiences, traumatic things that children experience, could be violence in the home, childhood verbal abuse, physical abuse, or sexual abuse, domestic violence in the home, a parent with untreated mental health and addiction issues, a parent being incarcerated, those types of traumas. Adverse childhood experiences are issues that are a risk for trauma to be exacerbated and can actually be prolonged during this pandemic. If you think about living in a home where you might have a lot of tumultuousness and trauma and not having the opportunity to be at school, which may have been your safe place. The harm to children during isolation and quarantine may go unnoticed and underreported initially when schools aren't open, but most instances of child abuse and neglect are identified by schools. And so we expect to see a significant increase as schools are reopening. As many as 30% of children involved in quarantines may experience some sort of post-traumatic stress disorder, which is a rate that's 7 times higher than children who haven't experienced quarantine. I mean, that upending the routine and that isolation can really have an effect on many children, certainly not all children, but many children. And children who are from lower socioeconomic levels are disproportionately at more significant mental health risk. Just like lower socioeconomic issues or families and families who live in poverty are at risk for a host of other health conditions at higher risk than the general population. That's also true with mental health. And experts expect that children most affected by COVID-19 are those that are going to face economic, racial, or other inequities that may have been more pronounced and traumatic since the pandemic began.
Mm-hmm. How is this different from what adults are going through?
The pandemic's impact on employment, income, housing, and food security threatens basic survival for many families. It creates significant stress and anxiety that is usually borne by adults, but kids will feel that stress too. Then we have the issue for frontline, especially in the beginning of the pandemic, but still frontline and essential workers had a whole nother level of stress altogether that they were facing at the beginning of the pandemic. And parents, and honestly, especially mothers, have been overburdened with worries during the pandemic. Women have, and mothers have experienced a higher rate of job loss and potential job loss, COVID-19 exposure at work, eviction fears, working remotely and simultaneously parenting and adapting to online and hybrid learning that sometimes schedules may be changing frequently are all difficult. And adults who also have pre-existing mental health or substance abuse disorders may find that their conditions have been exacerbated during this time as well. So while stress may look different for each person, it can lead to anxiety and depression for children and adults alike. For some individuals, there's been an increased rate of substance use, suicide, aggression, and abuse, all of which can obviously have devastating effects on children as well.
Mm-hmm. Yeah. As we mentioned, like pandemic and other mental health issues can have a big impact on young people and children. How can we all be part of suicide prevention, ending homelessness, promoting mental health, and criminal justice reform? How can we be part of those actions, all of us?
That's a great question. What citizens can do to help is, first, one of the things that people are doing right now through this forum is educating ourselves about these issues and continuing to push this dialogue forward, whether it's in our family or among our friends, whether it's in our community of faith, our workplace, our university, our whatever it might be. And it's definitely about talking about these issues at some point with our policymakers and our elected officials. Some of the ways people can advocate for quality mental health and addiction treatment, which is important at this challenging time in particular in our state's history. As we know, as you mentioned at the very beginning of this dialogue, we have higher rates of mental illness and addiction than most states in the first place, which shouldn't be surprising to us, right? We have high rates of all diseases in our state. We're not a healthy state. And as we have these high rates of diseases, it's not surprising we have high rates of mental illness because it's a disease just like any other disease. It's just a disease that affects the brain. And so as we know that we're facing these issues in this important time, we've got to prioritize funding for mental health and addiction treatment, even if we have a difficult budget. It is so crucial that instead of all the people who need help, that 25% of our population that needs help, of that group, only 1/3 are getting it. The door to get into treatment is too narrow. We've got to commit more resources at our municipal, our county, and our state, as well as our national level to widen that door and let more people get help. We've got to support policy solutions that minimize addiction, trauma, and death. That includes continuing to support mental health insurance parity. That's a huge issue in our state and our nation, making sure that insurance covers these diseases the same way they cover other diseases. And that's called insurance parity. We also have to fully fund Medicaid expansion, which I know our legislature is working on right now. We have, on any given day, several 100,000 Oklahomans without insurance. And of those, we know about 92,000 of them are struggling with untreated mental health issues. So getting people covered through Medicaid expansion that was voted on and passed by our Oklahoma citizenry is really important. And finally, we need to spread the word. And for those who are able, donate to whether it's Mental Health Association Oklahoma or other nonprofits who are providing services and causes that you believe in related to brain health. It sounds cliche, but every dollar really does make a difference.
Yeah. The one thing that resonates with me so much is in the beginning, we talked about how important it is to have access to mental health services for these young people. But in reality, it kind of costs an arm and a leg. There's not enough services, but if there are, they're expensive. But thankfully, we have services like Mental Health Association of Oklahoma. So that's really good. And just mental health in general is a very big and broad topic. We can't possibly cover everything, but I would like to give some time for our audience over Facebook or Zoom if they have any questions they would like to ask Terri. While we wait for their questions, Terri, is there anything one thing if you would like to tell young people about their mental health, would you have any message for them?
Reach out for help. If you're struggling, don't think that you have to do this alone. Sometimes I know it can feel like you might be the only person experiencing it, but it's very common and we know how to help. We just need people to reach out.
Mm-hmm. Thank you. Let me see if we have any questions. James, do we have any questions? Should we wait for the questions, or would it be possible, Terri, if we share some contact information if they watch it later over Facebook and they have a question so they can reach out?
Absolutely. We will share how to reach out to the association. Just remember that 211 is there if someone is struggling or you're worried about someone, 24 hours, 7 days a week. Our website is obviously there and has immediate connections as well, and our phone numbers. We'd be happy to also answer any questions. And you're able to submit those through our website, and we'll share that contact information as well.
Terri, thank you so much for sharing a wealth of profound information for this very important topic with us. And thank you for being here with us. We hope to do future things like this. It doesn't have to be specifically Mental Health Awareness Month, but it's important to raise awareness about this issue every month of the year as opposed to just one. So thank you for being here.
Well, thank you so much. And I really want to thank OKSA. Having this discussion today, when you asked earlier, what can we do? You're doing it. So thank you for having this important dialogue. And if anyone is listening now or later and needs to reach out or has questions and wants to contact us, please do. We're happy to help. The whole reason we exist is to improve Oklahoma's mental health.
Thank you.
You bet. Thank you very much.